The National Association of Seadogs has taken significant steps to deliver essential healthcare services to a rural community in the Federal Capital Territory, Abuja. Our correspondent Miriam Enahimion filed in details of the story.
Over the weekend, the National Association of Seadogs NAS, also known as the Pyrates Confraternity, conducted a free medical outreach in Kubaba village located within the Buhari Area Council of Abuja. The event was jointly organized by NAS, local Zuma and Sahara Deg chapters. Between 150 and 200 residents benefited from various medical services, including blood pressure and blood sugar screenings, laboratory diagnostics, and general health consultations. Organizers highlighted the urgency of the initiative, noting that Kubaba lacks any nearby public health facility. The nearest hospital is roughly 18 kilometers away, making healthcare access a serious challenge for residents. The outreach coincided with two significant milestones for NAS: the 91st birthday of the founding member, Professor Wole Soyinka, and the 40th year medical career anniversary of Dr. Joseph Oteri, the organization's capon and a staunch advocate for equitable healthcare. Dr. Oteri, who has practiced medicine since 1985, explained that the initiative embodies the group's ongoing dedication to reaching undeserved populations. In the joint outreach by Zuma and Sahara Deg chapters, the association brought much-needed medical services directly to the village.
NAS on its own have been doing a lot of medical outreaches. In 1996, I did an outreach in Rivers State, right, while I was still in Port Harcourt. And after that, we'll be doing outreaches at every quarter when we go for our quarterly meetings. So this is just to show that since you were in charge of all those outreaches, let us celebrate you with an outreach. So this is what we've done. Community, most times what we do, we support the downtrodden, right? People that couldn't afford some things are the ones we actually target. So if you look at most of these people here, some of them might not even have access to paracetamol if they go to a clinic. So we felt, okay, let us bring all the things they need. Normally, they start with the scoping mission where they find out what are the prevalent ailments in the community. Then they procure drugs to take care of those ailments. So they have a lot of human resources, doctors, nurses, and volunteers, plus laboratory people. So that's why they're all here doing this work to be.
Just the start. We're going to come back here on a later date based off what we've seen today. Because this is just asking them to come for the basic checks, the basic medications, treating malaria, the sepsis, the basic things you see in an outpatient clinic. That's what we're doing here today. Off of what we're doing today, we'll go from there. Follow-ups on the other specialties, we'll invite them to come. About capacity, this is NAS. What we're doing here is, our central body is aware we're doing it. We have the capacity to even go beyond the numbers, if need be. Yes. For a start, we're attending to the basics. Free medical checks that would help us indicate whether you're hypertensive, diabetic, the C-class that don't even know their status. They're always in the hospital. We have two cases that we've identified this morning that are C-class. They're always in their local hospitals. They give them markings and all that without knowing that these guys are actually C-class. We're also offering our lab interventions that will help us detect all these things. The basic investigations, the lab, the full blood count, what do you call it, the panels, hepatitis panel, HIV panel, all of those, so that you know where you are, so that we can go from there.
Also, an area mate with NAS Area 9 Command stated that community service is central to the organization's mission. He expressed hope that the initiative would spur wider investment in rural healthcare system.
So we organized this outreach to honor both of them. We think that as a social advocacy organization, the best way to honor them is to come to the less privileged, the underserved, to make sure that we also offer some help to them. So essentially, we decided to come to Kukwaba village in Kubwa here to do this medical outreach.
Local residents spoke emotionally at the event, recounting tragic stories of life lost to untreated conditions like hypertension, and women forced to give birth at home due to lack of access to skilled medical care.
1 year plus now. If I'm sick, I do go to like all those big pharmacies from DBA. If the sickness is much, I'll go to all this private hospital. So the general hospital is far from this place, very, very far. That is it. Some of them that they don't have a private, that they cannot go to private, they don't even have money. You know, sometimes they do go to pharmacy and just get, you can see that what they are sick for, they're supposed to spend like maybe 40,000, 50,000. Due to say they don't have money, there's no primary health care here, they will just go and afford something of like maybe